Season 15, she commits insurance fraud when she claims that a patient is her own child in order to get the proper medical care. She spends more time in jail for that one. Meredith doesn't often think before making decisions for her own life. This leaves her family in a state of constant fear. She thinks irrationally and is willing to sacrifice her own life for nearly anyone. In Season 2, Meredith sticks her hand in a body cavity with unexploded ammunition in order to save a patient and a worried paramedic. Episode 15, in Season 3, she falls into Elliott Bay and has one of her most terrifying near-death experiences, but she does nothing to try to save herself from drowning. The Season 7 finale, she is walking around the hospital while there's an active shooter in the building. She then offers her life to the shooter when her husband is in danger and miscarries her first successful pregnancy because of the stress. In Season 9, she assists in her own C-section during a major power outage when there is no trained doctors available. Meredith has gone through a lot, maybe more than the average person should, and with that comes quite a few major diagnoses. She gets major depressive disorder, borderline personality disorder, along with post-traumatic stress disorder, all likely from a combination of events in her life. She has a high likelihood of developing Alzheimer's, just like her mother, and she in fact did test positive for several genetic markers, which is a touchy subject because of her past trauma. Meredith was born and raised in Seattle, Washington. She attended college and medical residency in the state. Throughout American history, surgeons and doctors have been predominantly male. In most hospital settings, the highest position has been or are male-dominated. She continuously faces social norms while focusing on her goal of being the best there is. Medical professionals are seen as one of the highest on the metaphorical pedestal of professions in the United States.